Network webinar. I hope you are all coping well and with the pandemic and staying healthy. My name is Nancy Gupta and I am part of the performance analytics team here at Canada Health InfoWave. And I thank you, all of you that have taken the time to join today's webinar. For anyone new joining today, welcome, and we hope you will continue to be interested in our future webinars. The goal of InfoWave's BE Collaboration Network is to connect digital health leaders, evaluators, and researchers to share best practices, results, and other insights focused on evaluation in digital health. We have regular webinar series such as this one to share new evaluation insights. We also use this network to share updates on noteworthy evaluations related activities that are on our radar. You can visit the website through the link you see on the screen to stay up to date. The slides from today's webinar will also be posted there as well. Our membership is continuing to expand and grow, and we invite you to join us or share information about this network with anyone who may be interested. To join or share any interesting digital health evaluations you are working that you would like to share through this network, you can get in touch with us through the email on this screen. So during this webinar, we will hear from Global Digital Health Partnership collaborators from Netherlands, Estonia, and Canada, where they will provide us an overview of state of their citizens' access to personal health information in their jurisdiction, various approaches and solutions, and its impacts. Today, we will hear from Sheila Maloney. She is Executive Vice President in the Engagement and Marketing team at Canada Health InfoWave. We will also hear from Harko Koemens. Harko is a digital health policy wonk who builds international alliances and partnership at the Netherlands Ministry of Health, Welfare and Support in The Hague. He has over 15 years of experience with e-government development, but also found his heart is in digital health and innovation. We have Florian Marcus. Florian is specialized in e-governance, voting, cybersecurity, and public policy. Florian is a digital transformation advisor at the Estonia Briefing Center, where he presents the advances of the Estonian digital society to public and private sector stakeholders. We have Lillian Lee. Lillian is the Director of Partnership Programs and Strategic Health Initiatives at eHealth Saskatchewan. Within her portfolio, she led the Provincial Personal Health Record Initiatives for Saskatchewan, known as MyHealth Health Records. We will also hear from Ryan Gallivan. Ryan is Executive Director, Strategic IMT Services at Alberta Health. Ryan currently has oversight of the electronic health records, consumer e-health, architecture and delivery, and quality and insurance testing units at Alberta Health. We have Abdul Lawal, who is the Director of Consumer e-Health for Alberta Health, with prior experiences spanning across different sectors. Since 2015, he has been working for the government of Alberta on the MyHealth Records program to provide Albertans with access to their health information. We would like to extend our thanks to Simon Hagan, Senior Director of Performance Analytics, Canada Health InfoWave, who will be doing the Q&A session at the end. So, consistent with our typical format, we will hear from the presenters first, and we will hold questions at the end during our Q&A session. All your lines have been muted, and I encourage you to use the QA function or the chat box to pose your questions as they come up throughout the webinar. We will pose the questions on your behalf to the panelists at the end during Q&A period. You can also write the name of the panelist along with your question if you want that panelist to answer your question. So over to Sheila.
Great, thank you, Nancy. And welcome to this webinar, and I'm really excited to be here, and I'll just give you a sort of a kick it off and give you a high level overview of the GDHP, the Global Digital Health Partnership. And I just do want to, before I start my remarks, have a special thank you, and hello Hergo, it's been a long time, we haven't seen each other for a while, from the Netherlands, and thanks so much Florian for joining us today. We really appreciate you, and we recognize there's a time difference for you as well, and of course to our folks in Alberta and Saskatchewan, thanks so much for joining us. we know actually there's a time difference for you folks as well, not as severe, but a little bit earlier morning. So I just wanted to have a couple of, I just wanted to really set the context a little bit and talk to you all about GDHP. So the Global Digital Health Partnership, and Nancy, I'm assuming, are you flipping the slides? Yeah, okay. So Global Digital Health Partnership was actually started in February 2018, so it's not that long ago. And the first inaugural meeting was actually in Australia. And so there was a number at the time, I believe there's only like about a dozen or so countries. And really this is around, and you'll see the vision statement there, it's really supporting governments and health systems to improve health and well-being across the globe. And global digital health is a relatively new phenomenon, lots going on. And it was really an opportunity for governments to come together, government agencies and the World Health Organization to really compare notes, frankly, and work collectively around issues that are affecting all of us globally. And when you think about the things that are most concerning, and that's what we did at the original meeting in Australia, we sat down and said, what are the priority areas that we're all struggling with? And what are the ones that could most benefit from global collaboration? So there are 5 work streams that were actually identified given that criteria. There's a work stream on interoperability, one on evidence and evaluation, which Simon was very actively involved, or is actively involved in, and would be near and dear to everybody on this call. Cybersecurity, again, global issue, no question. Policy environments, what policies do we need to support digital health? And then the last one, consumer and clinician engagement. And I actually chair that work stream. And this gave us an opportunity to really, it is what, you know, as the name implies, it's how do we ensure that clinicians and citizens are engaged with digital health, and how do we ensure that they have the tools and the training that they need to have an optimal digital health experience. So the next slide talks to this particular work stream. And what we did was we decided and we asked about where we would focus our efforts initially. And so the problem statement that we came up with, and this was again based on discussion at our work stream meetings, we're having our 7th summit. So there's meetings takes place a couple of times a year. We are meeting at the end of this month. The US is actually hosting this virtual summit. And so at these sessions, and I think we're up to, I think well over 30 countries right now, and developing countries as well as developed countries. So it's a really interesting and excellent collaborative. So when we talked about the consumer and clinician experience work stream, where did we want to focus our initiatives and our efforts? And so we thought citizens' access to personal health information can improve health outcomes. We know that the evidence is very, very clear. And as technology continues to enable data transparency, we just wanted to know what the implications were, positive and negative, about citizens having access to their own health information. And we chose this topic, you know, really for sort of a couple of reasons. One is because when you think about it, citizen access to health information is relatively new. And then we thought because of that, this would be an opportune time to really talk to what we can learn from each other around this and share best practices. So I think my final slide, I'll just give you a high-level overview of the key themes. Oh, I should say, yeah, thank you for this one. So this is a copy of the workstream document, the white paper that was produced. It's available to you if you're interested, gdhp.org, or we can let us know and we can make sure that you get a copy of it. An international review of country approaches to citizen access to health information. We surveyed all of the members. We got 22 countries participating, some really good response. And you know, we'd like to brag that workstream, we had the highest level of survey responses in the work that we did. And then we actually did very specific, country-specific case studies. So really good information here. And so I'll just provide to you a little bit of the summary of the key findings and an overview. And so 60% of the survey respondents, yeah, next slide, reported that having e-access, so they're personal health information was accessible to all or most of their citizens. So that was sort of a nice piece. And then we asked them questions around what approach they took. And most of them had a sort of a blended approach where they had regional sessions, and then some of them had it more based on a national initiative. But most countries had sort of a blended approach and were moving more towards a nationally coordinated efforts around this. When we asked them why, what was the main reason for doing this, they most all of them cited patient engagement and empowerment, and that probably won't surprise you. We know, as we said before, an engaged patient has better health outcomes. So that was really important, and obviously from an economic perspective as well. And then limited evaluation of impacts, but evidence is available. So one of the reasons why we talked about this was when we actually surveyed, the world around this, there wasn't a lot of evidence right now what the impact was. So we thought this was a really good, promising area to focus in. And then the other piece that just the final findings that I'll leave you with is that we really understood that clinician attitudes and the roles of the clinicians were really important around patient engagement. And so if the patients had access to a portal, for example, many of them would say, well, what does my doctor think about this? Or I want to ask my doctor. Or if the doctor recommends that they access their information, they're more likely to do it. So those are a very high level overview of the findings. And then I think I turn it over now to, is it Herco to talk about what he's doing?
Thank you, Sheila.
So thanks very much.
Yes, thank you. And thank you for inviting me for this webinar. So I'm going to talk about the Dutch Personal Health Data Trust Framework. And because that isn't a really good title, we called it Met mij, where the trick here is met is in Dutch also with, and mij is me. So it's also not just a medical me, but it's also with me, which is marketing very easy. You could communicate with me, share with me, things like that. I'm Herco Komans. I work at the Dutch Ministry of Health as the International Digital Health Coordinator. Next slide, please. Oh yeah, there's an animation there. Next slide. So since July 1st of this year, there is a new law in effect in the Netherlands that allows every citizen to get a digital copy of their own electronic health data. And this is still a bit limited because it only goes for the data that's already in electronic form, but you can get it as a digital copy and you can do with it whatever you want. Next slide, please. But what happens if you have your own data? So first problem for patients was, who has my data? I don't know. So I don't have the overview. And in the Netherlands, we have a decentralized healthcare system. So we don't have any central government run healthcare delivery facilities. We don't have any government healthcare facilities. So we have about 100 hospitals, about 5,000 or 6,000 GPs that all have parts of your data. And I'm not talking about the paramedics or rehabilitation centers. So patients were worried that now that they have the right, would they have to claim that right at all these different healthcare providers to get the data. Next slide, please. So one of the things we did was we asked patients what they wanted. And one of the things that came up was that they didn't want, or they wanted to have a trusted information source that they could share with their doctors. So the quality of the discussions that they had in the consults would go up and would actually increase the patient safety and the quality of the outcomes. Next slide, please. And one of the other things was that many patients felt that if they were more in control, they would have a more equal relationship with their doctors, and that their own experience of dealing with their physical or mental limitations every day of their lives would empower them and would increase the outcomes in their terms as well. So these were very important reasons to take the next step. So what happened was and when I say we, I actually mean the Dutch Patient Federation, which is an umbrella organization representing about 150 different patient groups. And they came up with this concept of a personal health environment. First, we thought of, let's make it a personal health system or personal health record. But then we said, well, it's not just about one single use case or one system. The wide range of opportunities here and of use cases that you want to be able to cater to is so big and so wide that let's bring it up a notch and take it to a personal health environment. That would allow you to get a set of tools, digital tools, that you can carry with you throughout your whole life to collect, manage, and share your health data. So you can be empowered, basically. And this isn't just about healthcare data. This is about health data, which isn't just from your clinical visits or your primary care visits. It's about your social network, about your financial situation, about the environment that you're in. So potentially this could be a real you-focused data point. Next slide, please. So instead of going for one system for everything that should have to do everything for everyone, we went with a framework that third parties could then be certified to, and that we know that the services they would offer to patients and to healthcare providers would be safe and trustworthy, and that if something went wrong, there would be a way to address this. And if there was a data breach, then everyone knew what was going to happen. So basically, it's like what they have in the US is a TEFCA for the health exchange networks. This is sort of like the same framework for personal health data outside of the healthcare provider domain. So the framework clarifies the roles and the responsibilities of all the parties. It has the governance model, it's maintained, it has the standards that everyone needs to comply to. It basically is just a list of rules. Next slide, please. So the MedMy framework defines two roles. One on the person side, the patient, but they're not always in the patient role. It could be a consumer, it could be a citizen, it could be, well, just if you're healthy, but you still want to be able to control your health, then you're not identifying yourself as a patient, so just as a person. So that's why we use the person as the most general nomination for that. And on the other side, we have the healthcare provider domain. And basically what MedMy does is secure and safe communication between those two. So it has ways of controlling how you trust each other. How do you know that the data comes from your healthcare providers, hasn't been altered along the way in the communication or seen by someone else, and that it's actually about you and not about someone with the same name. And in the Netherlands, we do have a national citizen identifier that is mandatory to be used in healthcare as well. So that makes patient identification and provider identification easier. But this is basically the ground rules of the MedMy framework. Next slide, please. So within this framework, there's providers, service providers that are certified to those rules. And when they get through the certification, then we know that their communication is safe, that they do the right kinds of authentication, that they have the right kind of governance, that they use the right registries to find the healthcare providers that might have data from you, that you can authenticate both the user or the person and the professional, And what's interesting here, I think, is that it allows you to actively send data from one end to the other. So if there's a trigger for me to send my updates to my healthcare professionals, then it allows you to do that. So it's a two-way system, which makes it really interesting. This is based on HL7 FHIR APIs, which are also internationally standardized, or we're trying to do that at least at the use case level. But it can also deal with HL7 CDA documents and even PDF-A unstructured documents that at least have some metadata about what the contents of the documents are. So there's different levels of data that could be transferred here. Next slide, please. And of course, we looked at the business case, even though for us it's mostly a public business case. But this slide shows that in a conservative scenario, the benefits for the Netherlands alone are 4.2 billion euros in 10 years. So that's where the benefits could be, and you see a breakdown in where those benefits are. And this was before we even had one of these certified service providers out there providing services. So that's why the scenarios were conservative. Next slide, please. The problem here is that the benefits are not at the same place where the investments should be. And a click, please, because then we get... because here you can see that the costs are mostly at the technology side, at the process side, at the healthcare providers end. And of course, there's some maintenance that needs to be done at the framework itself. But the benefits are far outweigh those by having a more actively engaged population within their own health, which is something that we're now seeing in this public health crisis. The benefits could probably be a lot higher than we have now. But also in our payers model, where we have private health insurers that with a more prevention-focused, data-driven approach, the healthcare consumerism could go down, and that would help get some costs. So one of the big challenges that we're still working on is how to create a sustainable financial model that would allow us to redistribute the benefits to where the costs are. But we're already building the program for healthcare providers to free up the data that they have in those APIs towards those MedMij certified service providers, so that the 420 million euros that you see in the healthcare first bar is an investment that we already have done. Next slide, please. So the current state of play with MedMij is that there's currently about 30, or it could be 32 right now, service providers that have already gone through this process and are now implementing their services in the real world. Some of our major EHR vendors are on board, and one of them is Epic, that is already working on getting certified. And there's one service provider that's started as a personal health record as a service provider. That's the PRAS service provider. This is for us an important part, because it allows these 5,000 GPs and these 100 hospitals to take one service provider and have all these different use cases managed for them, instead of having to have different kinds of contracts with different certified providers. There's one thing that we decided on early on, because the concept of this and the opportunities are so huge. It could be anything for everyone. So instead of just trying to do everything at the same time, this is about building trust. So we decided very quickly on a controlled rollout. So we start very small with easy to use cases that are easily implemented, and then we can scale up with other use cases. And I can give you a list of the use cases later if you want. And of course, the COVID-19 crisis has delayed this rollout as well, because especially on the healthcare provider side, the resources were needed elsewhere. On the other hand, the need for data-driven healthy behavior has become a top priority now everywhere, and you see a lot of investments that are earmarked for economic recovery and resilience that will focus on digital health. So we have the framework, we have the rules. It is a level playing field, open market for us. So service providers can apply for those investments to be used within the MedMy framework. My final slide is a list of links that have some information both in English. Afsprakenstelsel is the terrible Dutch word for the framework, but there's, for more technical information, we have the STU3 FHIR profiles, all in English, and more information in English as well. Thank you very much, and I'm looking forward to the questions later on.
Thank you, Hako. Over to Florian.
Hello, thank you so much for that kind introduction, and also, of course, for the invitation itself. I hope you're all alive and well and safe at home. My name is Florian Marcus. I am a digital transformation advisor at the Estonia Briefing Center, and I will try to tell you as much as I can about e-health in Estonia within 7 minutes. I was thinking about how to do this presentation best, and I figured the easiest way would be to show you what it actually looks like for an Estonian citizen, or in my case, resident. I'm German. I've been living in Estonia for the last 5.5 years. So I'll just let you take a look. I would have to get my screen shared. So this here, I hope you can see it, is the Estonian patient portal, and you have to log in, of course. You will get to see my own patient records, which is going to be very exciting for you, I hope. So we have to log in, and there are different kinds of electronic ID carriers in Estonia. We all have an electronic identity, a personal code that is similar to what Herko also described earlier. But we don't just have the ID card, which has a chip card at the back. We also have an app that you can use. It's called Smart ID. I enter my personal code. You're being bombarded with many weird languages today, I'm sorry. And when I click on continue, we will see a control code on the computer screen and also on this screen. And then I enter my PIN 1, which is my authentication PIN. And then it says that is correct, and I will be forwarded to the eHealth portal. Now, in here, you see effectively everything all at once. You can see your dental care documents, time-critical data that can be accessed for paramedics. So if you have an accident, you call the emergency hotline, you tell them your personal code if you can, and the people in the ambulance that are on the way to the scene of the accident, they can already see what is your blood group, what is your, do you have any allergies, and what prescription medicines are you taking right now? So this makes it easier for paramedics to know how to treat the patient before they arrive at the scene of the accident, which I think is quite useful. Health declarations are needed, for example, if you want to serve in the military, for example, if you want to apply for a driver's license. So many different cases. You wouldn't go to a doctor somewhere in the army or something. You would just go to your family doctor, and they would transfer that health declaration connected to your personal code. Under case summaries, you can see every single time that I have been to a doctor or hospital in Estonia. So 3 times in 5 years is not too bad, I hope. And if I click on this entry, for example, then we can see, first of all, we can see that a lot of the data switches back to Estonian, because of course the doctor doesn't speak 3 languages, Estonian, Russian, English, and enters all of the data in all 3 languages. But yes, here you can see everything that they found. For example, my abdomen is soft and it does not hurt, which is wonderful news for me. The doctor seems to be quite happy. We can also see my blood results. We can see my own results here and the reference values on the right. So even if you don't have any medical knowledge, you can see I am at 4.5 and anything between 3 and 5.5 is normal. So I should be okay. So this also means that if you've been to the doctor 5 years ago, you remember not a single thing about the diagnosis, the findings, and so on. You can always see it here. One big question in terms of e-health is always also privacy. Herko was talking about gaining the trust of the population. In Estonia, I can always see, not just in the e-health system, but also with the rest of my data, I can always see who looked at what part of my data, when, and for what reason. This would also clear up cases such as, well, many years ago, I'm sure you've heard about the case of Michael Schumacher, Formula 1 driver, who was in Switzerland and he, well, in the hospital, and the media were asking, you know, what was the case, how was his situation, and some doctor somehow gave Schumacher's information to the public. And in Estonia, you would very simply know that Dr. XYZ looked at this patient record at this point in time. And this person, at the very, very, very least, would have lost their license for life in Estonia. And depending on what exactly they did, they might have to pay a fine and serve up to 14 years in prison. So we do take data protection and privacy extremely seriously. But we don't just have to rely on passive mechanisms like that. We also can just block the patient records ourselves. So we can see here, that is one other entry, and I can unlock it or lock it for a representative. That would be a legal guardian if I'm underage. Or, of course, I can also lock it for my own doctor and every other doctor in the country. But then it says, are you sure? Because if you lock the data, your treatment quality might get worse. That is, of course, true, but you know, it is up to you whether you want to make that medical history accessible to your doctor or not. Having had this e-health system around for the last 12 years, was also made it easier for us to respond to COVID-19. Namely, we just added one more button to the system that shows you the lab results, and you will find that I had 2 COVID tests, and I can also see that they were negative. Good stuff. So this also gives an easier overview for the health ministry and so on. We also have a contact tracing app, nothing super exciting, Bluetooth based, as anonymous as it can be. We can talk about that later if you want. Last but not least, I also want to talk about what we're working on right now. Actually, there's a very good example on this page here. Passport of immunization. Actually, you know, so this is something that we're working on right now together with the WHO as well. So we are working on a vaccination passport that would help in response to the COVID pandemic. Something else that's important is organ donorship. In many countries, you've got the ability to sort of submit your preferences. And being German, I submitted my preferences in Germany on paper, but I also submitted my preferences in Estonia electronically. Now the question is, which declaration supersedes? Is it the one where I was born, like my nationality and so on, or is it where I'm based? So digitalization also makes us aware of how far paper systems are lagging behind in terms of interoperability. That is one of the reasons why we at the eStonia Briefing Center have a job. So if you want to work on cooperation and data exchange between different countries, very much get in touch with us afterwards. I would probably leave it at this, with the exception of one last small recommendation. In Estonia, we use a system called the X-Road for data exchange between all the different hospitals and healthcare providers and so on. And they all use this X-Road system for encrypted data exchange both public and private sector entities can join, and many have done so. The source code for that is also on GitHub, and it's completely free. Many other countries have joined, so you might want to try it out as a pilot project. Last but not least, I will be here, of course, to answer your questions, both in the Q&A session and also via chat right now. But if you need to digest this, and I recommend that you do, you can also take a week or two and email us under estonia.com. You will find my email address and those of my lovely, lovely colleagues. Apart from that, have a lovely evening, and I'm looking forward to your questions. Thanks so much.
Thank you, Florian. Over to you, Lillian. I'm going to share my screen. Just coming up.
Perfect. Okay, thanks, Nancy, as you're getting that up there. So for the next little bit here, I'm hoping to provide some background regarding what we are offering here in Saskatchewan, Canada, in terms of access to personal health information online, and then also highlight some feedback that we've received in regards to having access to MyHealth health record over the past year or so. Let's get through. Okay, so to start off, I would like to frame where Saskatchewan is within Canada. So it is a province in central Canada with about 1.2 million individuals. So landmass-wise, Saskatchewan and Canada in general is quite large, but not densely populated by any means. And so healthcare services can be quite spread out, where there are individuals living in our rural and remote communities that may need to travel several hours just to receive care. I think that is quite important in terms of why we offered MyHealth health record as well. The next slide. So we launched MyHealth health record about a year ago in October of 2019. Current state, we have about a market penetration of about 12%. So 1 in 10 individuals, or 1 in 12 would have, or sorry, 1 in 10 or less would have access to MyHealth health record. I do have a little graph at the bottom there from launch to current state in terms of adoption. So it is worth highlighting that since we launched, there was quite a large demand. And as you can see, it kind of teetered at quite a few low points there in that March through May there. There was a bit of a peak when the pandemic first hit Canada and Saskatchewan. So there was a lockdown there, and you see it quiet down quite a bit. And then as we kind of moved into our second wave, there has definitely been a huge demand, increased testing, and folks have been signing up for MyHealth health record as a means to access their test results. We've also moved over to virtual care services quite a bit, as healthcare services are more through telephone or teleconference or video conferencing. And so that has added the need for access to information so that they can have those conversations with their healthcare providers as well. Next slide. So in terms of some key features and functionalities that's currently available to citizens who have access to MyHealth health record, we do have a provincial EHR, and so the data from those repositories are sent to the citizens' PHR. Some of the information that citizens have access to include items like lab results, medical imaging reports, clinical visit history, so really the registration information, such as when you've been admitted or discharged from the hospital, immunization records, as well as prescription history. It is worth noting that the results are real time, and it is 3 years worth of history that is loaded for the individual once they are fully registered. So once you register, you get access to 3 years worth of data, and then it grows organically from there. And then it is worth mentioning immunization history. Of course, it's only meaningful if you have lifetime history. So that is the full history, and then everything else is only the 3 years. And some other highlights I do want to note is, as we went forward with launching MyHealth health record, we definitely engaged a number of the clinical community members, and there's definitely lots of concerns raised in terms of potential issues with real-time access. We talked about the broad range of information that could be housed within lab results or medical imaging reports, and so lots of conversations about what should be available. And so we do actually offer a full suite of access, such as general labs, microbiology results, pathology results, and even when the pandemic hit, COVID results were also real-time and available right off the hop there. And it has been central for citizens, just because accessing the results from the comfort of their homes in real time. And then also there's been a number of situations where they've indicated they require printouts of the information or evidence that they were tested negative for COVID. And so travel, back to work, back to school, lots of use cases where the PHR was quite central to returning to work or returning back to the slow opening after the lockdown. And then some other highlights that I want to share would be pieces about sharing. So initially, when we had offered MyHealth Health Record in October, it was for individuals who were residents of Saskatchewan, so they do have to have that health services number. All the information is tied to the health services number. And then it was more independent users accessing their own information. And then we did offer some sharing capabilities, as well as some proxy access for parents with individuals under the age of 12. So I see we're on the slide in regards to the citizen feedback that we were gathering. So we did launch a citizen survey for those who have access to MyHealth Health Record at the end of summer there into the mid-September timeframe. We sent the survey out to about 74,000 individuals, and about 13,000 individuals ended up responding. So we did have a fairly high response rate. Next slide. Some highlights in regards to the demographics of those who did respond to the survey. You can see here that those who responded did gear towards more the 55 to 75 age range, even though the user base for MyHealth Health Record ranged from about 25 to 45. So there was a gap there in terms of the user base versus those who did respond, but happy to see the large number regardless. And then it is also worth noting that we did find about 50% or so of the individuals who responded did indicate that they do have a diagnosed chronic health condition. So again, sharing those use cases where PHRs may be of more interest to certain age groups as well. Next slide. So then in terms of some highlights for user experience, so the greens there would be rated fair or poor, and then the blues would be excellent or good. So one of the highlights that the citizens shared were positive, were definitely the real-time results or the timeliness of the results, and those reminders or those prompts that there is new information in their PHR. Mobile optimization was another key piece that was identified as quite central, just because we know most people are using their smartphones or their tablets, et cetera, to access the information. And then some pieces in regards to improvements on the registration side. It is quite a lengthy process just because it is being done from the comfort of your home without having to be in person or anything like that. And so we do want to make sure that security measures are in place. Next slide. So in regards to some of the user impacts, so this is worth highlighting that when we first launched or prior to launch, again, through our engagement with the clinical community, there were a lot of concerns about potential stress to the healthcare system, just because individuals are now accessing their information in real time, and potentially before the provider might even get a chance to review the information. And so there were lots of concerns about stress levels, lots of phone calls to say, hey, my information is or my results out of range, and it could be negligible or non-concerning for the provider. And so it was definitely a huge piece in regards to measuring those stress levels and the management of their health. So even though here on the screen, you can see that the lighter green indicates no change, and from our perspective, not only significantly improved or somewhat improved is a positive, but the no change to the stress levels and some of those other factors are considered positives in some ways as well. And then this last slide here is in regards to some of the outcomes in terms of impacts to the patient as well as to the health system. So you can see here with our with 13,000 individuals sharing their experience, we saw that there was about a 70% decrease in walk-in clinics, 8% decrease in avoided emergency department visits. So we think about the cost to the healthcare system in Canada for a bed, for diagnostics, for tests. Even the wait time for some of that information for patients is significant. So if we're able to avoid duplication of testing, fewer unnecessary walk-ins or emergency department visits, even to the patient to be able to reduce travel costs, time off work is significant. And that was ranked at about, or feedback at about 30%. So that was a lot of information, but happy to hear the questions and comments after. Thanks so much.
Thank you, Lillian. Over to Ryan and Abdul.
Thank you very much. It's my pleasure to be here today to speak about Alberta's experience with citizens' access to personal health information. Just springboarding off Lillian's situational context. The province of Alberta is situated on the west side of Saskatchewan, and we have a population of approximately 4.3 million people. In Alberta, we have branded our personal health records tool as MyHealth Records. Next slide, please. I've had the privilege of being involved in this work from the perspective of a few different roles over the past few years. So today we're going to give you an overview of MyHealth Records, go over some recent statistics, and talk about lessons learned and future plans. In Alberta, our vision is for MyHealth Records to be more than just a personal health records tool. Over time, it is to become the place for Albertans to get access to their health information and online services provided by the health department. For example, registration of healthcare insurance, changing demographic information, accessing reports on cost of services paid by the government for the provision of healthcare. So we really see it as a portal and a springboard for access to broader services. Next slide, please. So currently, this is our provincial personal health records tool, which is accessible to Alberta's residents aged 14 years and over. It lets users view their dispensed medications, immunization history, lab results from our provincial electronic health record repository called Alberta NetCare. It also allows users to track and manage their health and wellness data through self-entry in journals. We also have connectivity and linking of data from consumer personal fitness devices and medical devices. Users can share their health information electronically, or they can print reports through the tool. And a recent achievement is we've allowed parents and guardians to access their children's COVID-19 test results, which was a really important functionality that supported citizens as we eased out of our lockdown and children were going back to school. I'll now turn it over to Abdul Lawal, the Director of Consumer eHealth for Alberta Health, to go into greater detail about some of the recent accomplishments and plans for the future. Over to you, Abdul.
Thank you, Ryan. So as mentioned, we launched MyHealth Records in 2019, March of 2019. We made it accessible to only adult Albertans then. And by November, already due to the large amount of requests that we got from the citizen, we had to start looking at expansion, what it would look like. I will talk about our approach later, but what we did then is pretty much to make it accessible to 14 years and over. At least allowing that subset of population to have access to the record. March 2020 is when we launched our sharing feature, which electronically allows users to share their information with whomever they choose to. The idea is they could share their information with their caretakers or even their providers if they choose to. That is something that's very helpful for the stand-with generation. And April, as we all know, by then that's when we got really hit with COVID. And we started taking actions in relation to COVID. And I will talk a little bit about it. But in April, we made COVID-19 lab results available. As Ryan has mentioned earlier, we had a subset of lab results already available, but we didn't have microbiology. So we had to accelerate and get at least COVID test results for Albertans to have access to, in real time. So that's the thing we did. Another thing we did is also a partnership with InfoWay, to introduce secure messaging tool through MyHealth Records to allow the users to connect with their participating community providers, healthcare providers, so that they could at least have secure communication during self-isolation. And Ryan has mentioned what we launched recently, the access to COVID results for the children, something again that we had to react to even though part of our roadmap is to implement parental access later on, we had to at least address the access to COVID result because of how important it is. And we know we need to support the back to school cases where children have to self-isolate and they need some information to do that. In terms of the rest of the COVID-19, things that we took, I think it's an interesting piece, right? I talk about some of it. The most important piece here to understand is that we had to accelerate our pace. We had to adapt to the environmental factors, in this case, a pandemic. For that reason, we just forget about our roadmap and do what is needed, pretty much what is needed at that point in time. It required us to augment our system in terms of capacity. It also has its own side effect, which is really positive side effects that come with it that I will talk to later. Next slide. So in terms of really the usage, let's go to the next slide. What ended up happening is we launched MyHealth Record with a pragmatic approach, a projection of 75,000 users per year. And 1.5 years later, here we are. We got much more than that. So when you look at this, it just tells you how much things have gone up for us. And as of today, if you go to the next slide, what you'll find is that we have, it says 335. We're already at 440. This was yesterday. Now we are at 440. We have an average of 12,000 to 15,000 users per week over the last 6 months. In terms of secure messaging, there are some stats that I provided here. You will see we have about 150,000 messages sent by providers to their patients, since we launched this tool, and about 50,000 from the patients. The lessons learned here is as simple as this. You could see that the message is actually sent more by the providers as opposed to by the patients sending a lot of information. A concern we had from the providers earlier is that they will be inundated with information, and messages and questions. That didn't happen, okay? Other things is just that we have about 50% in terms of mobile access versus desktop access. 3 years ago, it was 75% desktop, right? And the most used browsers, as you could see, are Safari and Chrome. Next slide. This is just something to share with you. The most viewed tool is still the lab results, 18% and sometimes even over. The surprise was related to, say, procedure and medical conditions, because it's self-entry at this point. We don't provide access to that information. It's in our roadmap, but we see people are very interested, and so it will guide us later on. Next slide. Lessons learned overall in general when it comes to the implementation of MyHealth records is people want all the information, especially lab results and diagnostic imaging reports. They want it all. We hear that from them. Parents want access to their information, and registration process needs to be simple. If it's not simple, it doesn't mean people will not go. They'll be motivated enough to register, but you will hear a lot of complaints. Security and privacy is very important for people to know that there's no big brother. Nobody is looking at their information. So that's part of our change management. Next slide. The rest I will just go through it because of lack of time. Clinical and public advisory group provided a lot of feedback. It is very, very important to do that. And I mentioned about the adaptation of the roadmap there. Always consider minimum viable product. Go with what you have right now. You can evolve as you move forward. That is the hard lesson that we learned that I'm sharing with you. I can provide detail later about that. All right, projects that we have that are underway is pretty much we do some enhancement. Mobile application is gonna come very shortly, and then it's expansion of all the information that we got from our provincial electronic health records. And we will start providing access to online services provided by the health department, by the Ministry of Health, where we can have people, accessing information about the cost of their healthcare, information about registration for their health insurance, which is really provided by the government. I will stop there and just provide you with an opportunity to ask some questions.
Thank you, Ryan and Abdul. Now we will head to Q&A. Over to Simon.
Thanks very much. And folks, what an incredible group of presentations. Really inspiring. We've got tons of questions and not enough time, but we'll get through a couple of them, and then we'll try to follow up with folks afterwards. So a first one, it was about experiences in some other provinces. And so specifically Quebec and Ontario, lots of exciting work happening in other provinces, Quebec and Ontario especially. We have talked about doing a version of this webinar later on that has other provinces involved, and would certainly be willing to do that if folks are interested. So that offer is out there, and please let us know about that interest. The question for the panel that I'll pose next relates to equity. So it had a comment about access doesn't necessarily mean participation. How do we break down digital literacy and financial barriers to allow full digital inclusion? I wonder if anybody wants to jump in and talk about their experiences around that.
Well, in Estonia, we like to say that the best service is an invisible service. So it's nothing where you need to type something on a tablet. It's nothing where you need to register for something, but rather that this is not health related, but for example, that if you get well, it's sort of health related. If you get a child, the doctor registers the birth of the child, you automatically get the notification, congratulations on the birth of your child, to which bank account do we send the money? You don't register for child support anymore. So this sort of logic that the government approaches you about the services that you are entitled to, I think that would be a good start. And in general, user-friendly service portals help quite a bit. We see that the nucleus of the family is also very useful. So maybe the grandmother doesn't always understand how everything works, but those social support systems we've seen are also very useful, next to state-funded education about computer courses in vocational schools and so on. These we have going since 1995, actually, and they're still running today if anybody wants to figure out how to use Google Chrome and so on.
Excellent. Would anybody else like to comment on health equity or ensuring equitable access to these kinds of solutions? Okay, we'll squeeze in one last question then, and we had a couple of questions that related to standards and interoperability across borders, or also interoperability with other systems that are used in the care processes. And I wonder if anybody would like to comment around the application of standards or interoperability in their solutions.
Yeah, I think that's one of the big barriers that we need to break before we are able to reap the benefits of this. So one of the things that we've done is next to this MedMai program, we've invested €500 million in getting the data out of these silos by hospitals, by general practitioners, and we actually used citizen access and the threat of people requesting their data as a crowbar, basically, to get the healthcare professionals, but basically the healthcare providers, the organization, to start moving. So we did sort of like a meaningful use program in the sense that the hospitals get incentivized, and the GPs and the social care organizations and maternity care, mental health care. So we've done it throughout the whole ecosystem, but they get incentivized if they show that they can actually send data through these APIs to patients and actually have services that patients can use for them. The next step for us now is we're working on a law that would make digital exchange of data mandatory. So that's when we can take the next step and lock basically those standards into practice everywhere.
Okay, that's all the time we have for questions, but I'll turn it back over to Nancy.
Thank you, Simon. I would like to thank you all our panelists for making today's webinar possible and providing great insights about the citizens' access to personal health information in their jurisdiction. I apologize that we are unable to answer all the questions, but we will be able to follow up with everybody's questions later on. As mentioned, the slides from the webinar will be posted on our website, so you will be notified when it has been. Also, I would like to thank you all the attendees for joining in today. We look forward to connecting with you again in our future webinars. And if you would like to follow our work, you can also subscribe to our newsletter, which is Digital Health Info Watch newsletter. You will be able to get the link once we post the slides on the website. Thank you again and enjoy your day.
Thank you.
Take care, everyone. Thank you.
Bye-bye.